slides.
Okay. Okay. Thank you.
Make it full screen, sir, so that,
Is it full screen now?
yeah. Yes, sir. Thank you. You are
So,
fine, sir. You are fine. Please go ahead with the
okay.
presentation, sir.
Thank you, Dr. Sudha Seshayan and the Tamil Nadu MGR, Dr. MGR Medical University for giving me this opportunity. And last two questions directed to Dr. Jayanti was like really, it formed a base for my presentation, like how any health facility should prepare when there is a surge capacity and when there is a local transmission, when a lot of people are coming to your health facility, like how there are some practical ideas other countries have implemented which can be adopted according to the local context and you can implement. That's what I'm going to talk about. So we all know how it spreads. There are a lot of investigations ongoing to better understand the spread, largely based on what is known from other coronaviruses. So it is presumed to occur primarily to close person-to-person contact, may occur when respiratory droplets are produced and infected person coughs or sneezes. But today there is evidence it can also be airborne infection, and like more evidence are awaited. So symptoms, like we already seen this, like symptoms may be in a fever, cough, or shortness of breath. There may be wide range of illness severity that has been reported from mild to severe, and complications include pneumonia, respiratory failure, multi-system organ failure, etc. So Dr. Velu has very covered very in detail that 80 more than 80% of the cases will be mild and uncomplicated. So only 5% require admission to an intensive care unit. So we know like why this is important, because when there is a surge capacity, like you should understand, like 80% of the cases can be managed in most of the health facilities when there is a surge and local transmission is happening. And also please, this as per the WHO and CDC recommendation, not all mild case illnesses require admission in health facility, but isolation to contain and mitigate virus transmission should be prioritized. So in this stage 1 and 2, when there is a lot of outside transmission, we will be able to do this. But when like admit all the patients and maintain them in isolation and things like that, but when there is surge, we have to think about like what would be rational for us to do, like whether to admit them or like how to manage them. So the goal of IPC in hospital preparedness for COVID-19 is support maintenance of essential healthcare services by containing and preventing healthcare associated COVID-19 transmission within the healthcare facility. So the main priorities are identify, that is early identification of suspected cases presenting for healthcare is critical. Isolate, that is prompt isolation of suspected cases to reduce opportunities for transmission in healthcare settings. And inform, communication to the public health response to initiate laboratory testing and coordinate patient placement. So this is mainly concerned towards when there is a surge of cases. So here you will be focusing in the identify and isolate, you will be focusing on triage and isolation procedures. So I am sharing what is happening in US. So already Tamil Nadu has implemented hotlines, and Rajiv Gandhi RGGH has also have a. The madam was mentioning they do have a hotline. So when there is a surge, hospitals should try to have a hotline so that the patient first call this hotline, discuss about their case symptoms, and and the hotline provider, like they can decide whether the patient should immediately come based on the symptoms what they are mentioning, because this will prevent unnecessarily crowding into your OPDs and like into your fever clinics. So there may be H1N1 also circulating, and there will be a lot of fever cases. So like you have to properly quarantine all the properly isolate all the symptomatics. So because we don't know like what illness he is having, but we have to provide proper precautions and all. So while they are calling, like you can advise about wearing a mask and coming, or like where they should come, like all those things, like if they are mildly symptomatic, which time they should come to the hospital, all those things can be handled by the hotline. So when there is a surge, this is very, very crucial. So apart from the like central hotline what states are having, always it is better to have a hospital level hotline, because like central hotline like won't be able to manage when a lot of local transmission is happening and more patients are having symptoms. So, for identifying the suspected cases, this is from US. So, in this hospital, they have made a makeshift of arrangement. Like we all know, all our hospitals are so crowded, all the OPDs are crowded, and if we cannot have a separate pathway or passage for the patients to come, like the symptomatics to come and get triage done. So you can do a makeshift arrangement where they can come, symptomatics can come, the screening can happen, and then if they are symptomatic, immediately they will be sent to a waiting area for further clinical examination. So, Madam was already mentioning, they had made a makeshift arrangement with proper distancing. So once the patient is symptomatic, immediately all the symptomatic patients will be separated to a waiting area with each patient, because like when there is a surge, we will not be having adequate medical professionals to handle this, because we have to run the regular clinical things also, and emergency things also has to be maintained in any of the hospitals. So what you can do is you can immediately when the symptomatic patient comes, first do the triage, separate them to a waiting area till the doctor sees. So like you can make a makeshift arrangement and place the chairs in 6 feet apart distance, so that you can still do some segregation of patients. So then after this, like consider using like we have already seen this, you can use temporary structures for triage and isolation of suspected COVID-19 patients before you are putting them inside the hospital into a isolation facility. So now preparing for triage, like ma'am has already mentioned, like you should, they have already put very nice signs for the facility, like where the entrance is, so where the patient should be directed, like where the respiratory symptomatic should immediately go. Like if you have a makeshift arrangement, the signage should be very, very clear, so that anyone, it should be in the local language and pictorial, so that any patients who is symptomatic immediately goes to the registration desk. And in the registration desk, you should maintain like adequate quantity of face masks. So all patients with respiratory symptoms, they should be given a face mask. If masks are not available, you can provide tissues, or like you can tell them to cover with a handkerchief or like something like that, because now we are day by day like seeing in newspapers that all the general publics are like exhausting the masks. So there may like they, many of the hospitals like private health institutions, they are experiencing like deficit of masks. So like if there is a situation, if you don't have mask in your registration desk for all the symptomatics, you can tell them to cover. And like if they are coughing also, like they should not be coughing on their hands, they should be coughing on their sleeves. Like all those educational materials can be put, and all this PPE, like all the IEC materials in pictorial things can be put in your hospitals and the surrounding areas. And also in the registration desk, like you should have a physical barrier like glass or plastic screens, so that the staff sitting at the registration desk will not have a direct contact with the symptomatic patients, and the triage staff are also like they are prevented from acquiring the infection. So these are the some of the triage plays IEC materials. And please, like the more things are pictorial, more people will catch it easily. So like already Tamil Nadu has developed wonderful materials, and Dr. Jayanti was showing a few of the materials which were put in Rajiv Gandhi Medical College. So you can put all it will be available with most of the health facilities. You can use this. So, and how to protect the healthcare workers at triage? All healthcare workers performing triage should always adhere to the standard precautions. So, and healthcare workers have convenient access to the hand hygiene products. So, this is again a major challenge. Now we are reading in press the hand sanitizers are running out, and Madras Medical College and many of the medical colleges in Tamil Nadu, based on the WHO standard recommendations, they are preparing in-house sanitize, like alcohol based hand rubs, so which is like very good thing. And like only thing is you have to maintain the standards as per the WHO recommendation, like what alcohol you should be using, what percentage of alcohol you should be using, and what the quality control measures you are doing, like for while making the things. So if you are ensure that like you follow all the norms, so then you can very well use this. And it should be made available for all the healthcare providers in your health facility. And healthcare workers conducting a preliminary screening that does not require a direct patient contact should maintain at least 1 meter distance. And like they don't need a complete PPE and all. So, but they have to limit the distance to at least 1 meter. They shouldn't be going near. Like if they are using a infrared thermometer and monitoring in your hospital, so they need not have a full PPE. And if the healthcare worker is conducting a physical examination of patients with respiratory symptoms, they should wear gowns, gloves, face masks, and eye protection goggles or face shield. So this is mandatory, and please ensure, like already steps might have been taken to stock adequate PPEs in all the health facilities. So, and you should also have a rational use of this thing, because sometimes, like during the initial period, you use for all the all the procedures which complete PPE is not needed, and you may exhaust all the things. So you have to be very, very careful. So while performing triage, the patient presenting for care should be screened for signs and symptoms of respiratory infection and potential COVID-19 exposure at the triage station. The questions asked during triage may vary depending on COVID-19 epidemiological situation. You very well know that definitions are also changing. Like earlier, it was only to China, so now travel history to any of the country. So when there is a local transmission, then definitely Ministry of Health and NCDC, they will be along with WHO, they will be changing the case definition. Please follow the updated case definitions for a suspected case. If there is no or little transmission in the community, then patients should be asked about recent travel history or contact with the patient with COVID-19. And if there is a widespread community transmission, when there is a surge of cases, questions about travel or contact with other COVID-19 patients are less relevant given the increased risk in the community. And triage should be conducted adhering to the local public health protocol. So whatever the Tamil Nadu Public Health Department recommends, like please follow that protocol, and this should be uniformly followed. And they are like working very hard, and they are updating all these protocols whenever Ministry of Health directs them, and it is happening immediately. So please follow the local public health protocols which are being given to you. And like this is a flow chart of how to triage a patient with suspected COVID-19 infection. This is based on the latest WHO case definition and the Ministry of Health and Family Welfare case definition. So when you identify signs and symptoms of respiratory infection and with fever more than 38 degrees and at least one sign or symptoms of respiratory disease.
Sorry, Dr. Valan. Dr. Valan, very sorry, we are interrupting you. I think you continue to be in Adobe. Please come into PPT and move your slides. The slides have not moved at all. We are able to see that you are in Adobe. Can you come into PPT and move your slides,
Sure,
please?
sure. Just a minute. Sure. So I'll share it once again.
You can go to the, yeah.
Yeah.
Good, good. That flow chart, the flow chart.
Yeah, okay.
Make it
Yes.
full screen and, yeah, right,
okay.
right. That's fine,
Yes.
that's fine.
So first, identify the signs and symptoms of respiratory infection. See whether the patient is having fever, and if he has at least one sign or symptom of respiratory disease, that is cough or shortness of breath. If he is not having anything like this, then continue the usual triage and assessment and care in your regular OPD. If the patient has any of the symptoms, immediately place a face mask on the patient and just ask about the travel and direct exposure history. Has the patient ever traveled or resided in a country? So this is for the current situation. But this has to change when there is a surge of cases, when there is a local transmission. This becomes very, very less relevant, and you would just have to triage all these people to a separate waiting area and then examine these patients. And mainly what you have to do is you have to separate these patients from rest of the patient, place the patient in a single person room with the door closed or in a other designated area. I have shown you like where how you can place, because like we do understand like many of the places we have limited resources, so do a makeshift arrangement and just be keep the patients with adequate distance, at least 6 feet apart. And only essential healthcare providers should be designated to be doing these roles, because like we shouldn't be we should cohort the people, and we should decide like who will be attending these patients. And you have to have a roster of people, those who will be attending this COVID-19 patients in the triage. We shouldn't be exhausting all our resources and exposing them to these people. So form a team, and ma'am was already suggesting like in the RGGH they had already formed a team like who will be responding, who will be in the triage area, who will be in the isolation area. So every hospital, when there is a surge, like you should be prepared for that. So start preparing for that. And if the patient doesn't have like at present, if the patient doesn't have any travel history, so you can manage. So but what I know is in currently in Tamil Nadu, like only few hospitals has been designated, which are all our government medical colleges, so where these patients has to be sent. But when there is a surge, like the situation may change, and you will get a new guidance, and you should be prepared for that. And how to isolate a suspected COVID-19 case. So patients who are identified as suspect for COVID-19 through a triage process must be separated from other patients as soon as possible. Give the patient a face mask and ask them to put it on. If the face masks are not available, use a like towel or handkerchief for them, like so that like they don't expel the droplets and harm other people also. Place the patient in a single person room with the door closed, but not everywhere this single person rooms and isolation rooms will be a possibility. So if rooms are not available, you can keep them in a isolation ward, and but each bed should have at least 1 meter distance, and this is strictly this has to be followed. And this is what the national guidelines and all the WHO guidelines says, like you can if you don't have a separate room, then you can keep 1 meter apart each bed and have isolation ward. So only essential healthcare workers designated to care and support for COVID-19 patients should enter the isolation area, and they should be wearing appropriate PPE. Ensure that all healthcare workers caring for patients in the isolation area adhere to the standard contact and droplet. So if new evidence evolve, they may have to have a airborne infection control procedures also in place, and we may need to have airborne infection control isolation rooms. So this is a picture from news media. So how Rajiv Gandhi Government Medical College prepared. We have seen a lot of photographs shown by Dr. Jayanti. I'm not going into details. So additional IPC consideration for any health facility, the standard precaution has to be followed for all. So you should have proper hand hygiene, respiratory hygiene, and ensure that patients cover their mouth with tissue or elbow when coughing or sneezing. Offer medical mask whenever it is available while they are coming to the OPD. If they are symptomatic, immediately give a face mask, and perform hand hygiene after contact with respiratory secretion. And you should use rationally your personal protective equipments, and environmental cleaning and disinfection are the mainstay, which will again help you to prevent the infection spread within your healthcare facility. So transmission-based precautions for COVID-19: use adequately ventilated single rooms or ward rooms, wear PPE appropriate for contact and droplet precautions, use disposable or dedicated patient care equipment, like you can have separate pulse oximeter, blood pressure cuffs, and stethoscopes. Avoid transporting COVID-19 patients out of the room unless medically necessary. So don't transfer like here and there. So in Rajiv Gandhi Medical Hospital, they showed us like they had a separate lift and separate pathway for taking these patients. If possible, try to do this and don't unnecessarily shift the patient here and there. And limit number of healthcare workers, family members, and visitors in, for the patients, those who are suspected or who are confirmed with COVID-19 infection. So as far as PPE, like many people may have doubts like what what should be the appropriate PPE. You can use a gloves, medical mask, eye protection and gown like for any suspected or confirmed COVID-19 case. Shoes are not necessary for COVID-19 infection. This is not recommended by WHO as of now. And if you ask me like what gloves should be used, sterile or non-sterile, for routine things like you can use non-sterile gloves and but you should definitely have a face mask. And if you are doing a procedure, definitely have a face shield. So whenever you are doing a aerosol generating procedure, like when you are intubating or when you are working near the ventilator or something like that, so all healthcare providers like should wear a particulate respirator and so that like you regular surgical masks won't be enough and you should use a particulate respirator. So when an aerosol generating procedures are performed, the your isolation rooms like where the patient is kept should have a negative pressure for with at least 12 air exchange per hour or natural ventilation with airflow of 160 liters per patient. So this is very important. So now with more evidence coming regarding the airborne infection control, so we may have to arrange these things also in the healthcare facilities. So for the key points for the PPE use, PPE relies on consistent and correct use by the healthcare personnel. Trainings and practice of healthcare personnel is very much needed. So like every health facility, you can start training. Already there are enough materials provided by Ministry of Health and disseminated widely through all the states through Directorate of Public Health. So you can acquire this training materials and train your staffs how to do, when to use PPE. Risk of cell contamination is higher when removing PPE. So please, like donning and doffing procedures has to be very strictly followed. And there are videos available with the CDC website, and WHO also has a lot of videos. Like you can watch those videos. So this is this picture, like you can have this picture in your donning and doffing area, so where people can easily, if they forget also, easily they can see and they can observe and put the PPE correctly and remove the PPE. So most of the contamination happens during doffing of the PPE, so you have to be very, very careful. And when you are doffing, like for each and every step, donning and doffing, you should use hand washing for each and every aspect. When you are putting or removing your PPE, this is very, very important because you shouldn't be infecting yourself after seeing a patient like who had a suspected or who was a suspected or a confirmed case. So environmental cleaning and disinfection. So routine cleaning and disinfection procedures are sufficient. Focus cleaning on frequently touched surfaces like switches, bed rails, door handles, sinks and bathrooms, because these are the areas where this infection is spread usually by touching. And hospital grade infections are very much effective, and WHO and CDC both recommend this. And your routine use of hypochlorite, which is 0.5%, can be also used for all the surfaces which are non-porous. So there is no specific recommendation needed for this COVID-19 infection. And you can see like when these are the, I have shown here the places which are high touch surfaces. So all these places has to be cleaned with appropriate disinfectants which are used in your health facility. So strategies, again, coming to this, so during initial period itself, people are using face masks and all the PPEs for I'll be sharing the link in my last slide. So you can use this checklist, like how you can have a conventional capacity, contingency capacity, and crisis capacity of all the PPEs. And you can manage stockouts of this PPEs when you have a increased number of patients, when there is a surge due to local transmission. So these are some of the IPC resources, like you can take it from my slides. So there are good trainings from WHO and CDC website. so which provides you a systematic approach how to manage during this outbreak. So you can follow these things also, which will be very helpful for any health facility. I acknowledge my supervisor, Dr. Dan Vanderende, Paul Malpidi, and my country director, Meghna Desai, for letting me interact with you during this thing. And if you have any queries regarding triage during surge capacity, I am available for through email or a telephone. So you can contact me. And yeah, thank you very much for once again for providing me this opportunity. And if there are any questions, I'm available to answer.
Thank you very much, Dr. Wal.